A very good morning and welcome to the breakfast meeting. Kitui Flo is my name. As usual, we prioritize a lot of things in our lives. Money is one, food is another. However, one of the most important things to prioritize is health. And this morning, we're going to be talking health and why they are the right healthcare provider for you. Joining me on the show is a team from CCare International, and we're very, very happy to meet them. I'll start from the extreme end, since he's the only man, and we try and see if we can make up for the lack in balance. So joining us, Dr. Juma Kamai is the Director, Medical Services at CCare IHK. Hello and welcome.
Good morning.
Also joining us on the show, right next to Dr. Juma, we've got Dr. Miriam Mutero Musinga, who is the General Manager for CCare IHK.
Good morning.
Also joining us on the show this morning is Sheila Aboth, who is the Head of Marketing and Communications for CCare Uganda. Good morning and welcome.
Good morning.
So, ladies and gentlemen, let's talk about healthcare in general, yes, but also with regard to CCare, let's talk about innovations in healthcare. So Dr. Miriam, I'll start with you. Tell us a little bit about the innovations in healthcare delivery that CCare is bringing on board.
Thank you for having us on this breakfast show meeting today. At CCare, we are looking at innovations, and it's one of our key values in terms of how we do business and how we see ourselves growing into the future. Some of the innovations that we have brought in place in terms of ensuring better healthcare delivery are things around teleradiology, where we have partners that are multi-speciality hospitals out of the country. And they're able to view our radiology images, and they help us in terms of giving us a second opinion on the images, and being able to get more inputs in terms of radiology for our customers. So for our CT scans, our x-rays, we are able to get expert help through teleradiology. We are also working around artificial intelligence. We're not remaining behind. Around artificial intelligence, we're looking at solutions that will help make diagnosis much easier. So for example, for an EEG, an electroencephalogram, usually looks at brain activity. There are some AI programs that can help to read the report and to give a more accurate diagnosis. We're also looking at artificial intelligence for ECG. That's an electrocardiogram that looks at the heart activity. And through these AI solutions, we're able to get quick results, and that help us to make more accurate diagnosis, to be able to deliver quick and efficient services to the customers as quickly as possible. We also appreciate the fact that the world is moving. We're moving away from open surgeries into minimally invasive surgeries. So today you're able to do keyhole surgeries, as they call them, laparoscopic surgery. And we are really going away from having to do open surgeries. And this ensures that customers do not get big scars. It also ensures that customers do not stay in the hospital for a long time, and they can quickly recover and get better, and they're lower risk. We also have laser surgery, again, making sure that you're providing very quick services, very efficiently, in very good quality with very good outcomes. We also appreciate the fact that the customer is the center of everything that we do. And therefore, we've introduced a system called Pulse that helps us to receive customer feedback. So when you visit any of our facilities, you'll get a text message that will prompt you to respond and to give us real-time feedback. Through this real-time feedback, then we are able to improve in terms of the services that we give. Some of the key pillars that we look at when we're getting the feedback is around ensuring that the patient got the right medical treatment, making sure we had clarity and honesty in how we treated the patient, making sure that the patient felt safe while they attended medical services with us. We also want to make sure that we were simplicity, that the patient was able to understand the instructions given by the doctor, and that they're able to go back home and implement and get better. We're also trying to make sure that we can deal with the long waiting time challenge, which is quite common in many hospitals, including ours. And therefore, we've introduced a queue management system that will help give the customer visibility of their journey from the reception and through to the different sessions, just to make sure that you're making the customer more comfortable as they're waiting. Today, we're also not left behind. We've gone into digital healthcare, where we are looking at customers are able to book for a specialist online. They're able to come in for their visits, and as they arrive, we're aware that they're coming, and we've booked them in, and that increases efficiency. So you don't have to spend the whole day in the hospital. We can agree on an exact time when you come, and then you're able to get these services. Finally, we're looking at home care services, where we want to come home and provide some of these services to our customers at home. So if you need a lab test, for example, you can reach out to us and we can come and take blood samples. If you need some nursing care done at home, especially for customers that have chronic care needs, then we're able to provide nurses, we're able to provide doctors that will come and give you services at the comfort of your home. So we continue to innovate to make sure that we can respond to our customers' needs and challenges as much as possible.
Indeed, indeed. It sounds like you thoroughly address all these challenges in every area. It almost got a little technical there, but I'm glad that we still understood you very well. But when we talk about this, of course, there's always the question, these sound like very elitist things. The kind of services that we provide as both CCare and very many other hospitals seem to reach certain areas. When it goes as far as being able to reach, one, the hard to reach areas, but also getting outside of the urban and into the rural, what are we doing as hospitals and medical facilities to enable us to reach a bit more, Dr. Juma?
So, well, CCare, maybe just to paint a picture for how we spread around the country, we have 21 facilities. These are outpatient facilities around the country, mainly within the Kampala metropolitan area. And we have upcountry clinics that now are being transformed into medical centers with about 20 beds admission space and theater space, so that the simple procedures are done upcountry and we don't have to ferry these patients down to Kampala.
Yeah.
And then we come to Kampala and have our big hospital, which is CCare IHK in Namuwongo, a 140-bed hospital with all the specialties and the facilities that we have, theater that is done here. So what we are trying to do is, of course, decentralized service. So if you're in Soroti, you're in Mbale, you're in Gulu, you're in Lira, you're in Mbarara, you're able to have your services there, and you will only come for super specialized services in Kampala. And it's been one of the ways that we've done to bridge the gap, and we continue to go around the country and set up these facilities. And at the OPD facilities that we have, your average cost will be quite very low as compared to the hospital. And your turnaround time, your service, everything should be quick. You have a cough and flu, those are the clinics that you want to visit. So we are trying to have IHK as the facility to go to for super specialized services, like we are calling it now a multi-specialist center, and concentrate on that, give people advanced care. We have a program of CCare on the road, where we usually do camps in the hard-to-reach areas. We assemble our teams and then move down to areas like Jumani, Karamoja, areas that really are hard to reach, and then be able to screen them for early diseases that are treatable, and also give care that is needed, but also teach the communities on how to cope in light of the circumstances that they may face. Yeah. We as well, of course, know that the country is currently facing a divide in terms of the payer mix, people, how they are paying for these services. You have about less than 1% of the population who are covered by insurance, and their companies paying for them, but almost 99% will have to pay out of pocket. And then it brings the question of affordability into question. What CCare has done is to be able to bring all these services that people fly out for to the different countries and offer them at the cheapest rate within the region, within the East African region and compared to wherever people travel to abroad in Asia and Europe, we'll offer these services at the cheapest rates. For example, Dr. Miriam spoke about keyhole laparoscopic surgeries, and these we're able to package them in a package that is affordable to the customer. And we try to look at benefits beyond the cost, because if you have laparoscopic surgery, you're admitted for a day, you're discharged, it reduces cost in terms of time of recovery, how soon you get back to work, and these are the innovations that CCare is trying to put in place to ensure that there is accessibility for healthcare around the country.
Sounds quite accessible, and we're definitely going to get back to talk about something you touched about, cost and all of that. But one other important thing, apart from being able to reach all these areas, is what we do for those communities, the CSR component and why it's important to healthcare. So tell us, Stella, Sheila, what are we doing as CCare? Are there any initiatives that we're doing as CSR, but also generally, is it important for medical facilities to do CSR?
Yes, thank you so much. It's very important for us, and especially being in healthcare, to be running CSR activities. One, it's a sustainable program that I encourage all organizations that are out there that get profit to be having sustainability programs. In sustainability, there is something called Triple P. It deals in people, place, planet, and profit. So if you're hosted in a community like we've seen, CCare is hosted in 21 different communities. These are people who are hosting us. What do we do for them? They may all not be in position to afford services at our facilities, but when we get out there, he mentioned CCare on the road. It's one of the programs that we have under CSR.
Do we do this for free?
Yes, we do it for free. We also have a foundation, CCare Foundation, and its role is just to take care of communities. It has a project called CCare Caring for Communities. So being in those areas, Buliza, Karamoja, Iganga, places that you see they need the care, the quality of care, but they cannot afford in that moment. So sustainability should be part and parcel of every organization that is dealing in health, and for us, it's at the core of our sustainability program.
Okay, that's interesting to know. Another thing that he talked about was something called multi-specialty hospitals. Tell us a little bit about that. One, what are they? Two, what's the significance of multi-specialty hospitals in Uganda's healthcare system?
So CCare IHK is a tertiary multi-speciality hospital. What this means is that we have a number of specialties. We have about 40 specialties and specialists available at the hospital to be able to treat the patients. So it means that when you're sick and you've been admitted, we shall have a multidisciplinary approach where you have specialists from the different specialties coming together to discuss and to find the best way forward in terms of giving you comprehensive and efficient services. So it means that if you have a bad headache, you'll be able to be reviewed by a good physician. There'll be a neurologist on board. If there is need be, there'll be a cardiologist on board. There'll be a radiologist on board because you may need to do some investigations.
So basically all hands on deck.
Specialists. Yes, yes. So that makes sure that you get comprehensive services, and that we can also get the diagnosis much quicker and be able to give the right treatment as quickly as possible.
Of course.
And we continue to find ways to diversify, find ways to get more and more specialties into the hospital. So we currently have an in-house oncologist who's available every day. So we also make sure that we shall run clinics on a daily basis that will cover most of the specialties so that you can receive your care and support as soon as you need them. What we have in our different facilities across the country is we offer mainly primary health care. But if they'll find conditions that cannot be treated where they are, then through something we call continuum of care, we'll make sure we get these patients referred to the right specialists. so that they can be able to get the right care as quickly as possible. So those are some of the advantages of, the multi-speciality hospital, where you can be able to get all services under one roof as much as possible.
Okay, that's certainly reassuring. Getting back to you, Dr. Juma, there's something very important you talked about, and that's cost. But of course, they say you can't put a price on a life.
Yes.
Now, when it comes to good quality healthcare versus good quality services, are there ways to make it more cost effective without necessarily compromising the quality of the healthcare? And how are you enabling this as CCare?
Well, I think just maybe as a by the way, the biggest cost as Ugandans that we have to pay out for is for failure to make diagnosis. And as long as you do not make the diagnosis, you can't solve the problem.
Yeah.
So you make the diagnosis, and that's already half of the problem solved. And CCare IHK is able to offer all the diagnostic equipment. We have a C-lab that is able to run all the tests that you require. And once you have the diagnosis, then it becomes cheaper to treat. Is it surgery? Is it medical treatment that we will take? And that's the biggest challenge that we have. And like Dr. Miriam stated, that we have mainly primary health care provided at most of the clinics. Is when do they refer to the next advanced healthcare provider? And this has been the biggest challenge. So you will make 100 visits for maybe ulcers, for example, and you will never have done an endoscopy to eventually treat. So this is, of course, been the biggest challenge amidst the payer mix that we have, where we've already discussed that we have less than 1% of the population on insurance and corporates paying for them, and you have 99% of the population picking out of pocket. And currently we are listed among the countries with the highest out-of-pocket expenditure for healthcare services. But how often do families plan for healthcare? Everyone will food, there's rent, but no one will ever put healthcare in amidst the calculation.
That's ebigwabitaraze.
So it becomes a bit difficult for families to plan. And I read one of those reports that says half of the middle class that we have right now will fall back into poverty if there was serious
We're
illness.
all one medical bill away from
exactly,
abject poverty.
Exactly. So, well, I know we have a CCare Card, for example, where you're able to save. Prepay, you can prepay, and this, of course, given the fact that you're prepaying, comes with discounts on all the services that we offer. And this has been made available as an alternative to the insurance for those who are unable to afford.
Is this on the CCare Card?
Yes.
Okay.
We have
so how does this CCare Card work?
So you are able to register for a card. We give it free of charge, and then you keep loading money onto the card. That
whenever you get 1,000, 2,000.
Yeah, you just, whenever you move to the facilities, you can use for this card to offset your bills. Of course, the advantage is at discount. At discounted rates, and this has made a few of the families that have interacted with the card afford high-end services, plan for surgeries, especially planned surgeries.
So is this for one? Does this cover emergencies as well?
Yes.
Okay.
Yes.
So the thing about the card, it's already your money. Your money is already there. So
Okay.
whatever it is that you want to use the card for, it may not be you, but your relative.
Ah, okay.
Yes, or someone in Mbale, Soroti, wherever.
As long as I give the instruction, take this off my card.
Yes. Of course, there are terms and conditions when it comes to using the card, because you have to get authorization from the principal card owner.
Absolutely.
That is a story, a whole story that we may not discuss here.
Yeah.
But that's the flexibility of the card.
But because, of course, you create trust, prepaying, even when the card is depleted, there are chances that we'll discuss for how to pay, to settle the balance.
Based on the relationship.
Based
Yes,
on the
yes,
relationship that we have created. And this, of course, is quite significant in helping our communities be able to afford. But also through our CCare Foundation, we have outreach programs, and we offer free treatment for HIV, TB, and this is done at the facility. People are able to come in for those drugs, but as well as highly discounted cost prices on investigations that they do at the facility as part of our community outreach program. In terms of the cash payers, we have packaged our services in terms of surgery. So we are now able to give you a block figure as a price for, let's say, a delivery. And we know that no matter what, whether you stayed for an extra day, it's still covered within that. So for payers being able to know what they will pay without
in advance,
without a huge risk of it changing, has also been quite very, very important in helping the communities afford this. So we keep tweaking, and we ensure that even the advanced technologies that we bring on board, we try to give them to the public at an affordable price. And this is why I told you we will offer the price cheapest in the region.
I hope so. Still with you, we've talked about how things are changing. Dr. Miriam mentioned AI and adopting. Let's talk about adopting. Their medical needs are changing for people, and so are technologies and all of that. How else are we adopting as CCare to be able to fit that changing need and that growing community of adjustments and changes?
Well, talking about adaptation, the community right now is basically going to think about, I don't want a huge scar, I don't want to stay in the hospital for a number of days, I want to be home, how quickly can I go back to my work, there's fear that I'll be replaced, is it painful, and these are the things that we are...
Mental health.
Yeah, mental health. So these are the things we are trying to really, really bring on board. I'll give you an example for labor. We'll have painless labor right now. You're able to push...
Painless what?
Yes, painless labor.
Labor as in childbirth.
Yes.
Interesting.
So these are the services that we are trying to incorporate within our scope, and to ensure mothers enjoy their experience as they bring life to this country, to ensure that you have the keyhole surgery and discharged within a day or two. This
painless labor is 3 children too late for me. But go on, please.
So you have daycare surgeries for even what could seem as complex, a complex surgery. We'll have daycare surgery. And CCare is big on wellness. We're big on wellness. We have a population that is almost 80% youth. So it means that we have a chance and an opportunity to find out the risk early enough and be able to intervene. And we are big on wellness, have health checks every now and then, routine checks, cervical cancer screening, prostate, and different issues that we are able to treat early. We believe that early treatment is the key and provides the right solutions to our community and cheaper solutions. So these are the adaptations that we're incorporating into our service.
Talk about embolization.
Yeah, of course. Yes. Fibroid embolization.
Plastic surgery now, people are free to do plastic surgery and don't have to worry about
surgery.
Yes.
We've done tummy tucks, quite big procedures in there, arm lifts. So we are basically trying to offer everything. And I'll tell you, interestingly, for plastic surgery, people are happy to pay their money.
I'd imagine so. I'd imagine.
So very happy.
People are vanity. We are vanity. We like to be happy with ourselves. So I'd imagine. So it's good to know that all of these are brought a lot closer to the people now. And these services, are they available across all of your branches, or specifically at the Namuongo one?
So of course the IMCs will do the screening. For simple procedures they are able to do, they will be done there. But of course, for most of the advanced procedures, we'll need for you to come to Namuongo, and then you'll have this done.
Perfect, perfect. Now, before I come to you, Dr. Miriam, talk about the future of healthcare in Uganda, there's a very important thing that we left out at the beginning, and I know everybody at home is thinking about it, saying, wait, I hear you say CCare, I hear you say IHK. IHK was the more known name. Tell us about the rebranding and that transition and change. Why and how is it going?
So interestingly, CCare should have been named CCare, I think 9 years ago. Because CCare, there is a SEAL group company, it's based in Mauritius, that acquired the majority stake of IMG then, it was International Medical Group, to be, and it ran with it until last year when we said we've been married for these very many years, so why don't we just adopt the name? Just the way you get married to Kavuma, I'm joking. And
you take on his
and you
name,
take on Kavuma name.
Yeah.
So when SEAL got the majority stake for IMG, it had to bring on the name. The C is for SEAL group, and the care, just to relate with the
what you're
customer,
offering,
yes, what you're offering the customer. Everyone wants to be cared for. Even in marriage, people like care so much.
Absolutely.
So we say this care thing and the C will help us run in this market. So we did also a bit of refining our mission and vision we just refined. Of course, we couldn't reinstate the will. So we just decided to say, let's be the most trusted healthcare provider in the region. And we said the region, we don't mean only Uganda, we mean East Africa. Right now, we are scratching grounds in Kenya to see if we can move the 21 facilities in Uganda and we go to Kenya. Going to our mission, it's around care and trust and putting our patients first. Dr. Miriam talked about the patient pillars, right medical treatment, safety. That is us putting our patients first. When you come and you find Kavuma wants to see Dr. Miriam and a patient wants to see Dr. Miriam, who should Dr. Miriam give attention first? Yes, unless Dr. Kavuma is doing the diagnostics for the patient. Then we can say Dr. Kavuma first have the time for Dr. Miriam. Otherwise, we are putting our patients first and also realizing that majorly the people who come to our facilities are people who are learned. And this is us segmenting our markets. We know who comes to our facility and who would rather go to another facility. These people have their different demands.
Of course. Right
now we want comfort. You want to go to a place that is has the aesthetics that you left at home.
Sure.
So the rebrand also came with a change of our aesthetics. A person who came to IHK maybe 2 years ago and came today, there is a whole different thing. We have people who say, you have changed a lot.
Absolutely.
We've not changed just to win the wow, you've changed, but to give the comfort to the patient who is coming in. So the rebrand.
The reassured promise.
Yes, the rebrand came along with those whole lots of changes just to make our customer happy and comfortable and safe while they're in our facilities.
Absolutely. And just to reiterate, anybody who knew and was comfortable with IHK, it's the exact same except with a new promise for more and better care, of course.
Yeah. And this applies, by the way, to all the 21 facilities spread across. It's a different outlook right now.
Absolutely. I've seen it. I have one close to where I live. I think you have one next to roofings.
Yes,
I see it on my way home and I'm just
we
like,
are happy,
okay.
we are happy.
I wonder when I'm going to fall sick and go and experience.
No, you don't have to.
You don't have to.
I can just walk in and ask about
wellness.
Okay,
Wellness.
okay, for wellness and plastic surgery.
Yeah, well, we are happy.
I'll remember that. So,
Yeah.
Dr. Miriam, tell us about the future. First off, the future for healthcare in Uganda. Where do you feel it should go? Where do you see it going? And then later we'll get into the future for CCare.
Very good. So we really want to thank the government of Uganda for the efforts and the investment that they are putting into healthcare. Just recently, Uganda was able to do the first ever organ transplant. So there was a renal transplant done at the Mulago National Referral Hospital. And when the government is able to do it, then it means the private sector should follow.
Absolutely.
So the government has been leading, and we in the private sector are following in making sure that we can continue to advance healthcare services in the country, and we can continue to cut down the number of people that need to leave the country to go outside for further care. Today, the government has advanced care for cancer. There's a whole radiotherapy department in Mulago, and because we do not have one in the private sector, then it means that we refer our patients to the government for them to be able to carry out these radiotherapy services. And therefore, we are seeing a future where we need to be collaborative. We are looking forward to working much closer with the government as the private healthcare service providers to make sure that we can complement each other in terms of care that we have and they don't have. Of course, Being the government, it means then they have everything, but
We assume so, yes.
they may also not be available at every area, you know. Therefore, we are here to try and make sure that we can provide comprehensive healthcare services, and we see a future where the government continues to invest in healthcare, continues to be the first in a lot of these advancements. Some of these things will require laws, they'll require regulation, policies. So the government then plays a very critical role. And therefore from there, we are then able to, you know, take over and be able to support in terms of going forward. We're looking at partnership with the Uganda Heart Institute. They are able to do the open heart surgeries currently that we are not doing in our facilities, but we are looking to partnering with them, to referring our patients to them, and also seeing if we can have some of those services also offered at our facility, because I believe there are long waiting lines, and therefore how can we come to work together to make sure that we can shorten the times. Yes, so the future is going to be a lot more about collaboration, about partnerships, about we also partnering with hospitals outside Uganda. So we have a partnership currently with some of the hospitals outside the country, in Asia, in Egypt. And the key aim of these partnerships is to make sure that we can have knowledge transfer, we can work together for capacity building. There are procedures that they do quite well in India, for example, and we're not able to do them locally here. But those doctors are able to come in and do the procedures here, and also be able to work closely with our specialists to transfer the skills and to be able to give them the confidence to go ahead to do some of these things that we don't do very frequently. So also partnerships with, you know, super specialized hospitals outside the country to be able to bring in that knowledge. We also have partnerships where we can send our doctors outside the country to go and do observership, to go and do fellowships, where they learn on how, you know, we can improve our current care, our current services, and how we can bring in new technology and new innovations that can help us to provide care even much better. So there's going to be a lot of work in terms of partnering, in terms of collaboration, to make sure that we can move to the next level as a country. At CCare IHK, and with our support from CCare International, who is a parent company in Mauritius. In Mauritius, CCare is the largest healthcare provider in the country, and they have quite advanced, you know, healthcare services that they do. They've just recently opened a state-of-the-art oncology center, and therefore it means that for some of the oncology procedures that our customers cannot have done here, we can refer them to our sister hospital, where they can have these services received at, you know, at a good cost-effective price, but also to make sure that when these customers come back into the country, they're able to have follow-up and therefore continuum of care, and they can be followed up, and, you know, we can continuously have that engagement with the other doctors to make sure that we deliver the best care, to ensure that we get very good outcomes at the end of the day. So we see the future is bright. There are many things that we still do not do in Uganda. For example, robotic surgery. So we don't have robots yet doing surgeries, but we know that, you know, other countries are doing this already. So we're looking at being the first in making sure that we can make some of these services available. IHK International Hospital Kampala has been known for many firsts. So IHK did the first ever open heart surgery in Uganda in the private sector in 2007. We're the first ones to do laparoscopic surgeries. We were the first ones to do laser surgeries. We were the first ones to do fibroembolization. So for ladies that struggle with fibroids, we have fibroid embolization, which you can do without having to get a scar or a wound. We're able to do this through the interventional radiologists, and they're able to remove the fibroids without having to open up, perform surgery.
Sure.
So these are technologies that then ensure that you can have a procedure done and the next day you're up and you're good to go. And part of the things that we really invest in is around pain management. Pain management helps a lot in terms of recovery. So if you've had a surgical procedure and your pain was managed very well, it means you can quickly walk, you can quickly ambulate, you can quickly recover. And that will reduce the kind of time you need to spend
The lag time.
in the hospital, just because there's very good pain management. So there are also interesting procedures that we are able to do in Uganda. For example, cochlear implant surgery. We had cochlear implant surgeries done just last month. And these are procedures that are generally not done in the country, but we get specialists that come in and do these procedures in partnership with our own local specialists. And today we are able to give children an opportunity to hear and, you know, change their lives and change, you know, how they live their lives. So we are looking at a future where we are able to bring innovations, we're able to bring technology that will improve people's lives and make sure that there's a positive impact within the community in providing cost-effective, quality, efficient services with very good outcomes as much as possible. The future is bright. There's a lot of investment that we are getting from CL, our parent company in Mauritius, to make sure that we become the leaders. We continue to improve healthcare services, and we continue to contribute positively to Uganda as a
Continue
nation.
to be a company of firsts.
Yes. Yes.
Got it.
Yes.
Got it,
yes.
indeed. And you are indeed leading the charge. A final message. I'll start with you, Dr. Juma.
Well, for me, I think it's very important to remind the country at large that wellness is key. You do not have to visit the hospital only when you're sick. We can be able to identify these issues early enough, and the treatment is cheap and easy.
Indeed. Thank you so much. Dr. Juma Kavmaya is the Director for Medical Services at CCare IHK. A final message from you, Sheila.
So my message is to HRs, human resource managers in all our organizations. We talked about our costs, we talked about insurances, but you also know that it's only less than 1% of Ugandans that are insured, which leaves the 99%, those who cannot access government referral hospitals. We have an arrangement for the organizations, for HRs. You come, we get into an arrangement with you, we treat your people, and you can pay us later. That is also our contribution in trying to see that healthcare is a right and accessible to everyone, especially the working individuals.
Absolutely. Thank you so much. Sheila Oboth is the Head of Marketing and Communications for CCare Uganda. And a final message from you, Dr. Miriam.
Good. So I think we just want to remind Ugandans that healthcare in Uganda is improving. That today you do not have to go to Kenya, India, Europe, Asia for services. There are many services that are now available within the country. And we have the specialists who can be able to provide these services. And therefore, we would encourage that you choose home first before you think about going out of the country, because there's been a lot of improvement, and we see that there's going to be a lot of supports. We have also been able to invest in quality. We are COSASA accredited, which just reiterates our commitment to quality and making sure that we work around the quality standards that we have put in place to make sure that we provide safe medical services to the people. We are also positioning ourselves to capture part of the medical tourism market, We want to believe today that the people in South Sudan, Juba, don't have to go to Nairobi. They can also come to Kampala and be able to get the services that they would have gotten in Nairobi, for example. The people in Sudan, the people in Rwanda, the people in Burundi, the people in the Democratic Republic of Congo. We would like them to start looking at Uganda as one of those places where you can come to get very good quality, very efficient, comprehensive services at a very cost-effective price. So we will continue to commit to improve our services. We'll continue to ensure that we can increase the range of services that we give to the communities. We shall continue to go out to the communities. Today, lifestyle diseases have become very common. We have diabetes today that's a pandemic. We're dealing with challenges of hypertension, challenges of cancer, and we are positioning ourselves to be able to provide services in these areas by making sure we have the right medical experts to be able to attend to these problems, and ensuring that we have excellence at core for everything that we do. We also want to make sure that we are putting the customer at the center of everything that we do, in making sure that we offer client-centered solutions, and that we ensure that the customers get good patient satisfaction after they access our services. And we'll continue to work together through public-private partnerships to make sure that we can open up and provide even more services to more people across the country. We also have a commitment to continue to grow our footprint within Uganda. Today we are 21 facilities. We look at having 20 more facilities in the near future. We look at having hospitals across Uganda and not just in Kampala.
Absolutely.
So we just want to thank the government for creating a conducive environment for us to be able to operate, and for all the support that they give us. For example, recently, we're also in that partnership with Ministry of Health and KCCA to provide yellow fever vaccination. So we are happy to work with the government to make sure that we can continue to provide good comprehensive services, and we can continue to improve healthcare within the country. Thank you
so
very
much.
much.
Very well said. Thank you so much, Dr. Miriam Mutero Musinga, who is the General Manager for CCare IHK. And of course, with that message, I'd love to wish you a beautiful Tuesday, just to remind you that health is wealth. Kitui Flo is my name. Have a lovely day.
Thank you.